We'd like to welcome everybody to the conversation. And we're talking about a topic that some of us fear and some of us are very excited about, and that's the use of AI, especially in healthcare.
Dr. Dubey is an assistant professor in transfusion medicine at the Alinda Institute of Medical Science in Nagpur. After earning his primary medical degree, he served as a doctor in the Indian Armed Forces for 7 years, where he developed a keen interest in blood transfusion. Dr. Dubey holds an MD and a DNB in transfusion medicine. That's amazing. His notable achievements include the University Medal of Merit for MD in 2018 and the NBE Gold Medal for DNB in 2019. In the same year, he was awarded the ISBT Young Transfusion Researcher Fellowship in Basel, Switzerland, and was invited as a guest blogger for the International Society of Cell and Gene Therapy annual meeting in Melbourne, Australia. In 2021, he was appointed as an inaugural member of the ORCID Research Advisory Council, and he's been a contributing editor of the ISCT newsletter, The Telegraph, for the past 5 years. He's an active member of ISBT Clinical Transfusion Working Party and the AABB subsection for patient blood management, collaborating on multiple ongoing projects. His interests include clinical transfusion, stem cell transplantation, patient blood management, and data informatics. Recently, Dr. Dubey presented his artificial intelligent model for transfusion support at the ISBT 2024 annual meeting in Barcelona, where it was very well received by experts in the field. So today, he's going to discuss the latest advancements in AI and its applications in patient blood management and transfusion. We're so fortunate to have you here today. Thank you for your time.
Thank you. Thank you for the nice and long introduction, Marianne. And thank you, Sarah, for this opportunity.
So much we could talk to you about. We're going to have to really keep focused on our topic of the day. If I can ask you, Dr. Dubey, when did you first become involved, like aware of patient blood management and then really involved in patient blood management?
When I look back, earlier days, I'm reminded of an incident. At that time, I was a young, or I should say, younger doctor serving with the army, and we had a patient who had a gunshot injury, and I almost panicked, and I asked that there was so much of blood loss that we need to give him blood. We need to give him blood. A transfusion is needed. And I called up my superiors there, like, where can I get the blood? And very calmly I was told that giving blood may or may not save his life, but stopping the bleeding will definitely save his life. So when I look back at retrospection after 10 years, I realized that that was actually patient blood management, my first lesson in patient blood management. After I did my MD, it remained mostly a theoretical concept. Like, we had read in books, but hardly, especially in India, around in 2019 and 20, it was not practiced that much on ground. And then COVID happened. And with COVID, blood actually became a very scarce commodity. Like, there was hardly any blood available, hardly we had any donors. And that is when, by force, we were all forced to practice patient blood management. Like, there is a limited blood. With
True.
that, you can either save a patient who is in dire need of an immediate surgery, or if there is a patient who can wait, or maybe we can use iron supplements, or maybe even autologous transfusions. So before that, all these were mostly a theoretical concept, but due to COVID, we saw that it actually works. And there are things like, once you have seen it, you can't unsee it. So after that, I actually started advocating for patient blood management in whatever hospital I was working. And I have been a part of AABB PBM subsection, and we have been involved with a lot of surveys and ongoing projects. It has been a nice journey since then, and I'm happy to be a part of it and contributing to the cause.
Definitely. A lot of great projects come out of there. And thank you. That was a great overview. Really interesting story. What about this artificial intelligence? Can you tell us about that? And why are people so afraid of it?
Artificial intelligence, like, it's the next fourth industrial age, as we say, is driven by artificial intelligence. It is perhaps one of the biggest thing that has happened, not just in health sector. In health sector, we are actually lagging behind. In, if you see automobiles or even other places, AI is actually in a much advanced stage. Healthcare is yet to catch up. So coming to fears, we practice evidence based medicine, but our fears, they are not evidence based. They are mostly driven by narrative. And being a fan of Terminator movies, Matrix series, it is natural that everyone fears, especially the artificial intelligence and what it can do. Just in recent editorial that I wrote for Telegraph, that is ISCT newsletter, I had discussed this topic. And you can give answers to something that is based on evidence, but if something that is just based on perception, or how our contemporary fiction has shaped the narrative, then it's hard to actually give an answer that why we should not fear it. And the term that I had used is to be cautiously optimistic. I won't say that the fears are completely unfounded. It can go wrong. I mean,
Sure.
definitely, if there is a possibility that things can go wrong, but if we have to take some solace, or maybe some broader view of things, maybe artificial intelligence is part of a bigger intelligence known as infinite intelligence, which is at work. And that intelligence has been there even maybe before humans were there or not. Again, this is not evidence based fact, but if that intelligence decides that okay, it's enough for humans, they are no longer the most intelligent species, then it's all up to AI. So we have to be cautiously optimistic. That is all
Yes.
I can say. And fears are there. It won't replace humans, but almost in every field, as they say, people who use AI will replace those who don't use AI. As I see it, it is just like useful tool like internet or email. If you see someone who is not using internet in today's world, he or she is missing out on a lot. Same is with
Yes.
AI. So let's see how it goes. I could be wrong. I could be right. Who knows?
I know I've used that same conversational piece with people who tend to fear AI a little bit. Is that honestly, it's probably a bigger part of their daily life than what they even recognize. They're already participating. They have a smartphone, they have a newer vehicle, like you said. It's already kind of embedded into our the fabric of our lives, really. The next step makes sense that it'll be helping us in the medical field as well.
Yes, AI has been there. We might not have been actively participating with it, but with large language models coming up, it has become accessible to almost everyone. So that is how I think people are maybe a little afraid at first, but since it is accessible to everyone, it has got sort of level playing field. If you want to play or not, that is the question, but at least there is a level playing field now.
You said that AI is a tool, and that's one way that we can look at it to kind of alleviate our fears. How do you think that AI is going to shape the future of not only healthcare, but patient blood management? And also, do you think it's wise for clinical decisions to be made with the use of AI?
First, speaking from my own experience, when I was developing our AI based model, I first thought that what could it be used for? I mean, in which way it will be helpful to me? And I realized that there are many clinical situations. We have our day to day conversation with different specialists, from gynecologists to clinical hematologists, and they often pose questions which have, say, five, six different options available. And if I use my own thinking, I may be only giving two or three, that these are the two three options that you can explore. But when I started using I realized that there are a lot of different possibilities which can be used. For example, in PBM, if there is active bleeding going on, all we can think of it is what are the blood products that we can use. But maybe other alternatives like use of hemostatic agents, or maybe some other intervention which I may not be even that qualified to suggest. But if that AI is fully trained, it will suggest that apart from transfusion, there are these modalities which can be used. So that is just one small example in which AI can be used. If we take a look at bigger clinical decision making, I had read in a book and I completely agree with it. The name of book is Deep Medicine. that mostly clinicians make their decisions based on type 1 thinking. That is based on our experience, our intuition. We already decide, like, okay, this may be the diagnosis of this particular these symptoms, or this may be the best way of action forward. And there is another type of thinking that is more algorithmic in approach, that we start, okay, these symptoms can have these 10 different diagnoses, and we narrow it down. So usually our mind is trained to work in only one of these thinking modes, which and to think in both modes is quite difficult. So using AI, we can access those areas in which our mind is not trained to think in what they call as type 2 thinking. When it comes to a routine case or something that a clinician or any diagnostician has seen, say, multiple times in his or her career, it is easy for them. But once they are faced with a rare situation, or that they don't see normally, then that is where AI actually is helpful. In my personal experience already, whenever I have consulted AI for any advice, it has provided me with much more than what I can recall. So that is how I think AI is going to progress in further, not as a something that will compete with human, but something that will act as a tool for humans, whether it's clinicians, whether in lab, whether quality control, because it can be tailor made as per our need.
I think that's a good point, that physicians often treat based on their experience and what they've seen before and what they've seen work. And so, in a way, they're slightly biased, right? Like every patient should be new and fresh. And yet you have this bias that maybe you're not thinking of other things that you've seen less. And so, AI kind of gives you that unbiased look about, did you consider these other options maybe? Can you demonstrate for us a little bit how you came to build a patient blood management AI system that would be reliable enough to work with, to make decisions off of?
Sure. I have a friend with whom I was interacting last year. That time again, AI was just beginning to grow up, and I asked him how long will it take that AI actually shows up in our daily lives, or we start using it. He said that it's up to you. If you want to start using it from tomorrow onwards, we can start working on something. So that time, OpenAI was the only platform which was giving access to everyone to maybe come up with a custom built uh, GPTs, as they call it. If you can think, it is something like an app on an app store for artificial intelligence. So when I first used that GPT 3.5, there were multiple errors, or the answers were not reliable. Like if I asked questions for, like, what can be the possible diagnosis in these two three conditions, or a patient requires this, what can be a better transfusion solution for example, in a liver transplant or an ongoing bleed. And that time, that model, the answer which I got, it was not something that I could use in real life. Then I discussed with him that what are the various ways, and the first model which he told me that we can do is, we can make the answers more reliable. That is by using retrieval augmented generation, abbreviated as RAG. It is like, what are the latest guidelines, what are the standard textbooks. So I made a note of all the latest guidelines about most of the things. I summarized most of the AABB technical manual and other textbooks. I just made a note and I sent it over to him. He built a model. So the basic core was of this AI model was that every time a question is put up to it, it will go through the entire text, it will go through the entire guidelines, and then it will come with the answer. Compared to the other models which immediately start to give the answer, this model first analyzes the text, it goes through it, it searches for the answer. You can think of it as a student, that whenever a question is asked, he or she will read the entire syllabus and then give you the answer, which is not possible for us, but AI can do it. You put a question to it, it will go through the entire syllabus and then come up with the answer. And subsequently, by modifying the answers it provided, we were able to achieve a model which used to give clinically relevant and actionable information. So, like, I don't want to go through the entire paragraphs, entire explanation when I have to use it in real time. And that is what actually helped me. And then I realized that it can be used. So we have not tested on real patient data, but I kept on giving scenarios as and when I faced it, and it always provided with more options rather than what I could just come up with. And that was the first use. We compared with all the available models, and now the with more advancement, the pace with which AI is progressing is phenomenal. I mean, we did a study, and by the time I went on to present that study, the compared models were already outdated. This happened in
Hmm.
3 months. That
Yeah.
in a span of 3 to 4 months, the study that we did, that was already outdated. Google had a new model. Instead of Bard, there is Gemini. Chat GPT, they have an advanced version than 4. And there are so many things. So again, I asked my intelligent friend, his name is Abhishek, that. And second thing was, which bothered me, was there was no privacy control. I mean, I could feel that there were many examples that it was using the data and storing it. So from a medical point of view, you don't want to compromise on patients data or any data for that matter. So now we have started working on another project that is based on agents. Agents is something like, if we want to use whatever the model we have trained on any platform. For example, like we trained our initial model, which was based on retrieval augmented generation, for 4 months, and whatever information was there, we just copied the code and we put it on an independent website. These are agents. Agents are something that can copy the code from one model and it can be put to use, or it can be custom made. For example, I only want to use this model for medical decision, so we had put another agent. So with use of multiple agents, we can create a software which can be accessed just as a website. And many models, like there are different models available. What I explained to you is retrieval augmented generation, which uses the data that we have fed as a source. Then there is something called as random forest. There are multiple studies for predictive modeling that has been used, that have been using random forest, especially in blood transfusion requirement in cardiac surgeries, CTVS or cardiac surgeries. There has been a lot of AI based work going on in different parts. There is a paper from Australia. In China, there are multiple studies. The recent study was there from Brazil, and all of them have explored various models for predicting transfusion requirement during or after cardiac surgery and the outcomes. Because maximum amount of blood is, it is one of the areas where maximum amount of blood is required for
Hmm.
major cardiac surgeries. And all of them found that compared to traditional scores, which were based mostly on age, sex, height, and all those things, hematocrit. AI based models were better at predicting the cardiac surgery transfusion requirements. So, random forest is another model in which I'm planning to explore, and this time we will be exploring it on patient data. We have applied for the ethical approvals. So, hopefully, we will be starting with this project and see. It's like mainly just different tools are there. AI is a big umbrella under which there are multiple tools, and as they say, horses for courses. So what is your requirement? You select a tool and you just start to train it and you use it. AI is not going to be a very big single entity. It will be custom made. For example, my requirements for using an AI model will be different from maybe the doctor who is sitting in the next room. If we know what we want, then AI is there to help us. Like the famous saying goes, the quality of our life depends upon the questions we ask. Same is true for AI. The quality of response we get, or the quality of help we get, will depend upon the quality of questions we ask the AI model.
I'm glad you brought that up. I don't think that I ever fully thought about the fact that there is AI that you can just go to and ask questions and it'll pull answers from anywhere. And then there's that more controlled environment. That's really interesting. And that's what the medical folks should be focused on, those more controlled answers from the syllabus, as you said. Yeah, that's really nice. And I'm sure that's much more helpful than just random answers that people are getting. So thank you for clarifying those differences.
Can you give us an example of patient story where you used AI and you felt like it gave you options that you weren't considering at first, but it helped you kind of in your clinical assessment, helped guide you in ways to treat the patient?
Yes, there have been multiple scenarios in which I asked AI that what are the options available. Just a few weeks back, there was a clinical hematologist who checked with me that we run immunohematological tests like Coombs test, direct and indirect. So he said that my clinical assessment is not correlating with the results that I am getting. So can you just help me that what can be the possibilities? Like he was suspecting an autoimmune condition, but the direct Coombs test was coming to be negative. I told him that there is a 2% chance that this can be there. I'm not sure right at the back of my hand that what can be the other options. So I said to him, let me ask AI. And we had just discussed two scenarios. It gave us two more options. He was quite happy that none of us had thought on those lines, because that those scenarios, PCH, that is not that common in our area. So that was a referred patient who was sent from a different area. And that is actually when I realized that AI certainly works, especially if you see cases, and it is more common in referral centers where you can be getting patients from anywhere. I think that was one example. Second example was a case of massive bleeding. Should we give or should we not give cryoprecipitate? That was the question. I used AI just to maybe support that what I was thinking. I mean, of course, anyways, it wouldn't have made much of a difference, but at least it was for my own validation that yes, it was. I was thinking on the correct terms. Another important or interesting case was not at our institute, but a lot of people keep on calling me. So one of my junior colleagues, she called me that there was a major cardiac surgery post which there was a lot of red colored urine, and there was nothing which was suggesting that there is any immune mediated reason. All the tests, everything they did, but they could not find. And we discussed that what could be the cause. The last possible option that we considered was that maybe there is some problem with the surgery. The valve that they have replaced might need to be changed, and surgeons were not that keen because for them reopening was a big trouble, and they
Hmm.
did not even use metallic valves. Again, I put it to question to AI, and its second response came as it could be because of the valves that have been placed. So again, that was in future, if we have to convince our counterparts, like this can be an option, because no one wants to reopen a case. I mean, this would have been
Sure.
just a rare example, but the patient recovered. That ongoing hemolysis stopped once the surgery was done. Anyways, we would have suggested that patient has to be reoperated, but with AI also giving the answer, it supports your decision making, and that is what anyone would want to have as a tool, rather than just blindly reopening a patient, to have some sort of data
Yeah.
to support it.
Yeah. That's really interesting. You have me thinking about global implementation of patient blood management. So, if there was an AI for patient blood management, at this time, in my view, a lot of people think that patient blood management is bloodless medicine, or patient blood management is only surgery, or patient blood management is, whatever vague definition. And there's a couple of different definitions for patient blood management. AABB has one, World Health Organization has one that's kind of in line with the SABM one. And so there's a lack of clarity in patient blood management. How would you approach like gaining a global consensus or having like a go-to PBM AI app?
There are multiple ways. I don't think AI can be the best way to convince people right now, because acceptance is not there. But a different approach, which may not be related to AI, is based on real life scenarios or storytelling. It has been one of our other projects with AABB that we are working on, that how storytelling can be used as a tool to disseminate data in an understandable way. I mean, if I just keep on quoting studies that this study was done, this meta analysis was done, which says PBM works, it may not have that effect, especially on patients. Doctors may still understand it, but if we have to make, say, our the executives or those who are in not in a directly involved with patient care, maybe stories are what work more. We are coming up with an article, hopefully in next 3 4 months it will be there, and we have tried to take that route. How AI can use it, if everyone is using AI, and if it gives the answer that no, you don't do this, you do this, because they will have to follow some tenets which are universal for PBM, the three pillars of PBM or whatever, like to avoid transfusion if it is not the only option, to go for iron therapies before starting transfusion. So these are universal, and I'm sure unless someone deliberately tries to make an AI model which does not follow PBM, it will follow the basic principles of
Yeah.
PBM, because it has patient at the center. Nowhere it is written that transfusion should be the first go-to option, and then you consider giving hemostatic agent. That is more of a panic response rather than a
Oh,
informed choice.
sure, sure. And I like your narrative pedagogy approach, just that storytelling. People could really relate to that a lot of times, more often than just here's, here's what to do. Yeah, I love that.
You have really done a great job of convincing me that clinicians who utilize AI will have an advantage, an edge over maybe clinicians who don't use AI. My question is, how do we make sure that two docs of the same specialty aren't getting different answers from AI? So, are we all going to build like a universal healthcare AI in different specialties? Or how do we make sure that we're getting the same information if we're building our own AI?
Uh, Getting a universal AI will be difficult. Either it can be implemented at hospital or institute level, or it can, if we have to get not even universal, even a local AI. For example, I want my hospital to follow a certain protocol, irrespective of who the surgeon is or who the transfusion medicine specialist is. For example, if PBM is implemented, we will follow fixed guideline. So in that data form, we can include that AI based prospective audit. Already most of the things are computerized, we just have to put that agent thing over there, and it can be done across specialities. So there are multiple ways in which it can be done, but who will take the decision that I want to implement AI at this level? Whether the head of department or the person who is in charge of the department, he or she wants to make AI a common tool, or the head of the institute wants to make it, or say some at state level someone decides that no, I'm going to follow these guidelines. And you cannot always be blindly following guidelines. I mean, these are just for guiding principle.
Mhm.
Basic example is, suppose you take 7 and it is as a guideline for transfusing a non bleeding patient. How I can be sure that the lab report is not 6.5, which because of minor errors has come as 7? And
Mhm.
if clinically I see that patient is, she or she requires a transfusion, her oxygen saturation is not good, if even if it's showing HB as 7, 7.2, 7.5, that patient deserves a transfusion. And the other way around, it can be also true. Like, there are patients who are happily walking with, especially autoimmune conditions, walking with HB of 5, 6. If you give them transfusion, then they might land up in trouble. So, um, whether AI will have that level of sophistication, I'm not sure. But if a physician or a clinician oversight is there, that will always be helpful. I mean, we cannot blindly trust AI, because at the end of the day, that decision making power has to be with the person who is there by the bedside, who is seeing the patient, not just reading the data.
When information changes, like let's say that you've put standards into AI and then 5 years later, the information changes, can you take out the old information, or can you only add the new information to AI? And can it delineate that, oh, that's old practice and this is the new?
Yes, we can very easily change. I mean, making that AI model is as easy as maybe some other time I can show with OpenAI platform. If you want to use a standard check, you can make it within 5 minutes maximum. It will take. I know people who are using AI for, because especially for ABB assessments. If you see that something is non-conforming earlier, the ABB assessors, they had to go and see under which section it was not conforming. Now they just have to put it into the AI. It will give everything from section and all. I'm not directly involved, but I have heard from people who are using AI for, especially during inspection and making reports. Life has become much easier for them. And this is what they have told me. And at the upcoming ABB meeting, I think it will be discussed. I saw the list of papers, topics that will be discussed. So AI, especially with regulatory efforts, you need not remember anything. I mean, all the big tables, all the which number, which section of standard or anything. You can keep your mind free for decision making. Let everything, especially with numbers. I'm sure we all can agree that AI is good with numbers and remembering things than humans.
Yes, very much. It has been an outstanding
Yeah,
conversation.
I know. This is great.
I
Um,
think AI is going to be a conversation we'll be having for quite some time.
Yes, I think maybe in future you can call someone pro AI, someone anti AI, and we can have a debate as well. Maybe that will be,
A pro
you hear
cons
both sides
debate.
of the story. I
yeah.
mean, it is quite possible. Someone might be having a bad example, or God forbid, after say 6 months or a year, I come back here and tell you that I have been wrong. I mean, anything can happen. We have to have an open mind that we are not
Right.
following anything blindly. That is the first criteria of any scientific approach.
Yeah.
Considering, if I consider myself, especially as a teenager, he will be cross with me, like, how come you have switched on to the side of AI from which where all the villains have come in all those sci-fi movies? But this is how learning goes. So
Yeah, there's definitely a lot of positive, as long as you recognize and respect where things can go wrong and keep the patient first.
Mhm.
Yeah, that's
Good
really
point.
great.
Yeah.
Thank you for these great explanations.
As far as a takeaway message for our audience, what thoughts would you like to leave our audience with today?
first is that AI is just a tool. To think of it as a tool and not something doomsday of a dystopian future. I mean, I don't think AI is there yet. And if we keep on using it for greater good, it won't happen. We have survived bigger
Mhm.
things like atomic bombs and all, and we are still going fine. So AI shouldn't be that big an issue. And cautiously optimistic is the way to go forward. So that is how I see it. And I'm still open to accepting any point of view which can change with time. So that is there. The fears are not based on evidence, they're mostly based on narratives. So
Mhm.
with this hope, let's continue to explore what good AI can do to us, till how long it can do to us, and maybe it can help us be better, as artificial intelligence is just a subset of the infinite intelligence.
Yeah, this has been awesome. Thank you so much.
Thank you. Thank you for having me here. It was nice talking to both of you.
Mhm.
Lovely conversation.
We hope you enjoyed this conversation and found some takeaway or new thought that improves your health. We would love to hear from you. Feel free to reach out to us on our website if you'd like to see what we're up to. Our website is letstalkpbm.com. If you enjoy our conversations, please like and subscribe wherever you listen to podcasts and on our YouTube channel.
Special thanks to our guest and our producer Delaney Coronado and the entire production team for all of their expertise in content creation, technical abilities, and dedication to our message. We appreciate the experts who drive this medical movement forward and our affiliate partnerships who support the work that we are doing. Until next time, stay connected to your blood health.